Hello everyone, my name is Sneha Syriak and I'm a final year student pharmacist at Drake University. Today I'll be giving a quick presentation on Zegalogue, a new form of therapy for hypoglycemia that was approved by the FDA back in 2021. It is good to note that this presentation solely represents my opinions and my interpretations of the resources I have found for this presentation that will be listed at the end of the video. So let's begin. I first want to do a quick introduction on what hypoglycemia is, what our current therapies include, and why there is a need for more alternatives. So, Zegalogue or Dasiglucagon was created as an emergency treatment for hypoglycemia by Zealand Pharma, and it has been FDA approved back in March of 2021. So what is hypoglycemia? This is when the concentration of blood glucose is less than or equal to 70 milligrams per deciliter. Hypoglycemia can be asymptomatic, but when there are symptoms, those include sweating, tremor, palpitations, anxiety, hunger, and more. It can also cause some long-term effects. If an individual has recurrent hypoglycemia events, this can lead to hypoglycemia unawareness, which is primarily when the individual doesn't know or doesn't experience as much symptoms to know that they have low blood sugar. Hypoglycemia can increase the risk of cardiovascular accidents, cognitive impairment, decreased quality of life, and also death. Currently, glucagon is a mainstay form of therapy. It is used both in outpatient settings and is also a vital part of inpatient hypoglycemia protocols. It consists of 29 amino acids and works by inducing transient hyperglycemia. However, there are some limitations. Current glucagon formulations have low stability and can be difficult to administer. Some formulations require reconstitution and are intramuscular injections. In a study, individuals with glucagon emergency kits, 75 declared that they never carry it. Now, dasiglucagon is a new alternative form of glucagon. I will go into what it does, how it works, some side effects, contraindications, and a final comparison of it to other glucagon formulations. Looking at medicinal chemistry, Zegalogue is a glucagon analog. It is similar in that it still consists of 29 amino acids, but it has 7 substitutes for increase in stability. It is the first ready-to-use aqueous formulation. It's preservative-free, sterile, and colorless, and is used subcutaneously. It's indicated to the treatment of severe hypoglycemia in both adults and pediatric patients that are at least 6 years of age. Its mechanism of action is that Zegalogue is a glucagon receptor agonist. So it increases blood glucose concentration by activating hepatic glucagon receptors, thereby stimulating glycogen breakdown and release of glucose from the liver. Now looking at dosage and administration, Zegalogue comes only in one strength, 0.6 milligrams per 0.6 milliliters, so a 1-to-1 ratio, and has 2 formulations, an auto-injector and a pre-filled syringe. Each device is a single dose and cannot be reused. Looking at the different formulations individually, this is an example of how the auto-injector works. So it comes with a red case and a gray lid, similar to the pre-filled syringe. One nice thing to know about the auto-injector is that it does have a medicine window. So once it is injected, there is a clear indication to know if the full dose was given. And here is an example of the pre-filled syringe. So similarly, there is a red case and a gray cap, and this will be given at a 45-degree angle subcutaneously. Now, looking at the actual administration, it is important to first visually inspect the device. Make sure the solution is clear, colorless, and particle-free. If it is not, do not use the product. When giving the injection sites include outer upper arms, lower abdomen, front and back of thighs, and the buttocks. This injection cannot be done through clothing, so first roll back and expose bare skin. Once the injection is given, go ahead and call for help right away. Wait 15 minutes to check for a response, and if there's no sign of improvement, go ahead and give a second dose. Looking at storage, both products should be refrigerated. Do not freeze the products, and they should be stored in the red protective cases. If they're taken out of the fridge and are set at room temperature, there is a 12-month expiration, and do not return it back to the fridge. Now looking at warnings. Some adverse reactions of Dasiglucagon include nausea, diarrhea, headache, vomiting, and injection site reactions. These are most common in 12 to 17-year-old patients, but it is good to note that this can also be due to the hypoglycemia event that they just experienced. Some contraindicated conditions include pheochromocytoma, because this will increase blood pressure, insulinoma, because it may stimulate exaggerate insulin release and induce more hypoglycemia, and then decrease hepatic glycogen. Dasiglucagon only works if sufficient hepatic glycogen is present, as said back in the mechanism of action. Looking at special populations, there is no data for pregnancy, lactation, or geriatric populations, but for pregnancy, there have been animal studies where no adverse developmental effects have occurred at 7 times and 709 times the human dose. For lactation, it is to consider that this medication is a peptide, so it is expected to be broken down into its amino acids in the infant's digestive tract and is unlikely to cause harm. However, it's still good to know that there is no research or data to prove any other effects. Here is a chart comparing Dasiglucagon to other formulations of glucagon. Some things to note from this chart is that Dasiglucagon can only be given to individuals who are at least 6 years of age. So those any younger, sub-Q or intranasal or our emergency kits might be a better alternative. It is also good to note that it has a similar time to blood glucose increase to our traditional kits, and it's also important to note that it is more expensive compared to the other formulations at $370 per device. Thank you for taking the time to listen to my presentation today. I hope that we see more data and more research come about Dasiglucagon, and it will be interesting to see how it plays a role within our healthcare field. And here are the resources I used for today's presentation.